CCU is 1, 2, 3, 4, 5, 6. 16 in CCU. So with the COVID core, the importance of having the COVID core, this core group of 6 physicians, we wanted to minimize exposure of the transmission of this virus potentially to other physicians in the group. We also wanted to preserve non-COVID rounders and making sure that they're able to take care of these patients that don't have this virus.
Good morning, Miss Tanya. How are you? Good. How are you?
As medical director, I recognized the need and the importance of dedicated physicians to take care of patients with COVID. However, really, it was the hospitalists, multiple, that came to me and were volunteering to take care of these patients. So from my standpoint, I didn't do too much. It was other hospitalists really taking an active role in, number one, volunteering, but number two, again, trying to spearhead how we were going to take care of these patients and monitor updates for treatment.
So your vibe teetering at 88, 90%, I think we can move her around. Because she looks so much better than either numbers aren't up there, but we get her up there, that's fine. Thank you, ma'am.
This is going on month 5 of rounding on the COVID units for myself and the COVID rounders that have been doing it. So we've seen so much happen in such a short time, and it's been both sides of it, good and bad. It was never a question in my mind whether I wanted to help. I just wanted to make sure that we had enough help, and we'll continue to do so.
Listen, you're 100% better than yesterday.
Well, I guess we need to check with Emily to see if 7 can go to LMCEC with the hospital. You know, front lines to me are people who sign up knowing that their lives are going to be in danger, like our military personnel. You know, I didn't sign up to go to medical school thinking, oh, I'm going to be on the front line of a pandemic. You know, this is, but this is the reality that we live in, and I think it's important to, to stand up to that task. Hey, Mr. Dan, Dr. Clanton, how are you today? Good, you look well. I think about these patients when I'm at home at night, thinking about what we could be doing differently, what new treatments we need to start the next day to maybe improve things. Yes, that makes it way more difficult.
Yeah, it does.
We have hospitalists, they're married, they have other obligations, and there are times still where they cannot be working, and our hospitalists just step up, which makes my job so much easier. I really believe that you truly see what you're capable of in a time like this when you're facing an unknown in something so significant as a virus. And I believe our hospital in general has stepped up in a way that makes me proud.
Apparently he had a GI bleed in the ICU.
I may have to look at increasing her Decadron back up. A huge part of treating the COVID virus here at Lexington is taking care of the patients, touching their hand, making eye contact with them, offering comforting words. They're not able to get that, support from their family, and so we have to be that for them.
You are doing fantastic. Okay. Keep it up. You're doing real good.
What gives you hope, what gives you inspiration, what gives you motivation to do this every single day is when the patient gets better and get to go home. And that's what gives everybody hope.